Hello and welcome to Does Your Instrument Cleaning Process Need an Update? My name is Mary Gavoni and I will be the presenter for the program this evening. And I again want to welcome you not only for myself, but on behalf of Viva Learning. Hopefully you are frequent visitors to the Viva Learning ultrasonic cleaning solution. And we're going to talk a little bit about why they call their product Try Clean, because it does do an excellent job of cleaning our instruments for us. So here's our overview of the topics we're going to talk about tonight. Now, I understand for many of you, instrument cleaning is not the coolest, hottest, sexiest topic, and nothing really has changed for us in terms of instrument cleaning because of the COVID-19 pandemic. However, what we always need to do is pay close attention to our instrument cleaning process, because if you don't successfully clean your instruments, then you're not going to sterilize those instruments. And it's something that we need to feel confident about as dental health care providers, but our patients also need to feel confident about when they come to us for their oral health care. So we're going to talk about why it is so important. We're going to talk about different cleaning methods for instruments, and then we'll talk about what are the specific components. How do we fine tune our process? And some of these concepts may be old hat to some of you, some may be new that you weren't aware. And one of the things that we see very commonly in dentistry is that when someone new comes into a practice, particularly a dental assistant, but it could be another team member, they are trained by another team member. And so many times they are trained based on that other team member's preferences or what they know. And that's not necessarily a bad thing, but if they've not had any formal training, or they've not, for example, looked at manufacturer's instructions for how we use particular devices and equipment, then they may be training somebody new with incorrect information. So the one takeaway that I hope that you will have from this evening is that instrument reprocessing, meaning taking those instruments from being used to being reused, and all the way through the sterilization process, begins with cleaning. Now, many of you have probably seen this diagram or something similar to this that has steps in the instrument reprocessing cycle. We're going to focus strictly on cleaning this evening or during this webinar. And there are other steps that are included in here, but I tried to make it as simple as I could. You know, you use the instruments, you clean them, you package them, you sterilize them, you put them into storage. So we're going to cleaning, and that is our sole focus for this program. Over the course of the pandemic, it has occurred to me that finally many dental professionals are really paying attention to what do the regulations say that we need to do. For all of a sudden, there's so much more emphasis on it. So I tried to make this very simple for you. And we'll talk about OSHA, then we'll talk about CDC. And this is what OSHA says about instrument reprocessing. And they don't specifically say what type of a method that we use for instrument cleaning or reprocessing, but something that a lot of people don't necessarily know is that reusable sharps is what we typically, the legalese term for instruments that can be reused, and sharp items, which are so many of what we have, that if they are contaminated with blood, when we take them into our instrument processing area, they should be stored in a way that you can't just reach in with your hand into a container where they're placed so you won't puncture yourself. So we're going to talk about what that means in a bit. And OSHA also says that these instruments, as soon as possible, should be placed in containers until they're reprocessed. So that container could be your ultrasonic unit, or it could be a pre-soak, but this also applies to transporting instruments, and that's something I think that's overlooked a lot. So containers for transporting instruments need to be puncture resistant, color coded or labeled, and leak proof. They also have to be closed containers. So I'll talk a little bit more about that in a bit. So I've given you on your handout the link to the OSHA bloodborne pathogens standard, and it very clearly states all of these points if you need a reference to go back to say, wait a minute, this is what OSHA says. Now, as I said before, CDC doesn't have, or OSHA doesn't have a lot to say about instrument cleaning, but the CDC has plenty to say. And in the very beginning of the section in the CDC guidelines for infection control in dental healthcare settings back from 2003, this is our Bible, our main resource from the CDC on infection prevention. In the very beginning of that section on cleaning, sterilizing instruments, it talks about making sure that we are removing all the debris and the contamination so that it won't interfere with microbial inactivation if they happen to be disinfected rather than sterilized, or that it won't compromise the sterilization process. So just because we take an instrument and we put it into the sterilizer doesn't mean that all the microbes are necessarily killed or inactivated. Steam under pressure in an autoclave, a heat sterilizer, must be able to contact all the surfaces of the instrument in order to inactivate or kill the microorganisms. And if there is a film or a barrier of organic debris or inorganic debris, could be blood, could be some other substance, might be some restorative material on that instrument, then the steam can't contact the surface of the instrument. So it may be less contaminated than when it went into the sterilizer, but it absolutely is not sterile. And that's a very, very important fact. And that's the main reason why cleaning is so critical. The CDC also says that we need to look at cleaning methods based on how effective is it, what kind of equipment that we have, is it compatible with the items that we're cleaning, and exposure risks. So in other words, automated cleaning in an ultrasonic or in an instrument washer certainly decreases exposure risks because there's less handling of instruments, and the CDC doesn't like the concept of manually scrubbing instruments all the time. So automated cleaning is best, but sometimes scrubbing of instruments needs to be done. Perhaps an instrument has some serrated edges. We'll look at some examples of that in a bit. And it's tough to remove blood or perhaps bone debris from a bone file in the ultrasonic cleaner. But there are ways that steps that we can take to avoid having to hand scrub. And I've been a dental assistant for a very long time, and I come from the days of hand scrubbing instruments with no gloves, no personal protective equipment at all. We didn't wear that in the early 1970s, which is probably before many of you were born. And I can remember getting injured several times. I can remember getting a bad staph infection in my thumb because I poked myself with a contaminated instrument. And I knew the infection in my finger was pretty bad when it swelled so much that I couldn't get a finger cot on it. So those of you who aren't familiar with finger cots, I sort of irreverently call them finger condoms because that's sort of what they look like. You just roll them on to a finger or a thumb. And so when my infection got so bad, I knew I needed some medical attention for it. But it just never occurred to me back then that I could do something different like wear some kind of gloves when I was scrubbing instruments. Not to mention the fact that when you are scrubbing instruments, even if you're scrubbing them under water, some of the recommendations are to scrub under running water, you're still spattering and splattering whatever is on those instruments on your face and your clothing and so forth. So not a great thing to do. So the other issue we have with cleaning instruments is that the longer they sit and the debris is allowed to dry out on the instruments, it makes them harder to clean. So you want to make sure that you use some type of a holding solution, whether it's actually in your ultrasonic unit or whether it's in a pre-soaked tray, or you leave them in a cassette or on a tray and you treat them with a pre-treatment spray or foam or gel. But make sure that you do not use any kind of a disinfectant, especially a high-level disinfectant, which we used to call cold sterile solutions. Glutaraldehyde actually can work as a fixative and make instruments harder to clean. So the bottom line is get them in a solution that's a cleaning solution as quickly as possible. This is also something that is, I think, either not known or ignored a lot by team members, and that is make sure that you are wearing, in addition to a face mask and protective eyewear and a gown, puncture-resistant gloves so that you don't poke yourself, get an infection, get exposed to HIV or hepatitis B. And you also shouldn't be scrubbing instruments in soapy water where you can't actually see where the ends of the instruments are. So I gave you all this information so that if you need to go back to your practice, or you need to talk to a manager or your employer, or you are the employer and you need to talk to your team about these practices, you can actually go right to the language where it says what we should or shouldn't do. So I mentioned before about transporting instruments. Many practices have transitioned over to using instrument cassettes. I'm showing one of the stainless steel cassettes that's very commonly used, but there are others that are resin material, different kinds of plastics and so forth, different configurations. And yes, the instruments are stabilized and they're confined in those, but they still don't meet that OSHA requirement for a closed, covered container that's puncture resistant and leak proof, and also needs to be color coded. So an easy fix for this, rather than carrying your instruments loose on a tray, even though it's just across the hall, we know accidents happen, and to be OSHA compliant, you can make a small investment in trays with locking lids, like the picture in kind of in the middle of the slide here, or tubs that you might store your materials and things in, but you can fit a cassette or a large surgical setup in. You can lock them. You can buy them. Many practices that I know that do this will buy them in red. So red being the color for biohazard. And so we have one of these per treatment room. So I'm finished with my patient. I close up my cassette, or I take my tray and I put the lid on and lock it. And that is how I safely transport my instruments to the area where they're going to be cleaned. I don't have to worry about them spilling out, anybody getting punctured because we've tripped in the hallway, which would be me, and nobody is going to get injured from those instruments. You just need to disinfect those trays or the lids in between patients. And I think most practices can get by with having one tray or one tub per treatment room. We take it in, we take our instruments out, we put them in the ultrasonic cleaner, we put them in another container to pre-soak, we disinfect the lid or the whole tray or the tub and the lid, and it can go back into the treatment room and be ready for when we need it again with our instruments that we've used up. So one of the things, if you remember back to when we looked at the language from the CDC, is that instruments should be placed in a container for pre-soaking prior to cleaning. And pre-soaking doesn't necessarily have to be in a separate container, but it could be. You can simply pre-soak in your ultrasonic unit if you want to. The point being is that you prevent blood and other debris. Blood's going to be pretty tenacious once it dries on those instruments that you would be inclined to want to scrub. Use that as a pre-soak. Now, the one thing I discourage people from doing is this larger picture kind of in the center of the slide. This looks like a very nice instrument processing area. It looks highly technical to patients. And, you've got the red side for contaminated and the blue side for the clean or sterile. But when you have these cupboards, especially ones that are backlit like this, they get warm in the cupboard. So the idea is with this design is to get the clutter off the counter, get the instruments put away so it looks cleaner, looks neater, and especially if some of these instrument processing areas might be located in a hallway or with a glass door in front of them where patients can actually see where the sterilization happens. But I would not store instruments in this cupboard. They can be forgotten. The blood will dry out. You can pre-treat the instruments with a foam or a gel or some type of a spray pre-treatment that will help to prevent that. But I still find most of the time that it just is too warm inside there and it makes the instruments more difficult to clean. I would save the money on this type of cabinetry and maybe get a bigger space, maybe even some shelves where you could stack things. But there's lots of ways to be able to deal with that. So I mentioned before that blood, when it dries on, is especially hard to clean from instruments. So again, using some type of an enzymatic pre-treatment product, whether it's a gel or a foam or a spray that can sit on those instruments and already start breaking down the blood on those instruments before they get into the instrument washer or the ultrasonic unit works. Another trick I learned from several of my oral surgery clients, and I want to preface this by saying that this is only to be used as a pre-soak in a separate container, not in your ultrasonic unit. All of your ultrasonic solutions are designed to be at a certain pH that is compatible with your equipment. And you don't want to use disinfectants unless something is sold specifically for use in an ultrasonic unit, because you can cause problems with the functioning of your unit. The metal can be affected and things can malfunction. So this is a pre-soak only, and you can get heparin solution, which is an anti-clotting agent, and you add it to an enzymatic cleaner, or some people just add it to a detergent like a general purpose cleaner, just a couple of cc's. You don't need a lot, and it helps. It's like the blood buster. It really helps with surgical instruments. So just a thought, especially if we have any participants on that are working in oral surgery and they have a difficult time getting the blood off the instruments. I would do everything I could to pre-soak, pre-treat before I would resort to hand scrubbing, because it presents a risk of puncture and there's also that spatter. So what I'm showing here in the picture on the right-hand side are preloaded syringes of heparin, and they don't have a needle in them. They just have a stopper that these are actually used to flush IV lines. And so you can buy these already pre-measured. You just need 1 or 2 cc's, but again, in a separate container, not in your ultrasonic unit. The things that I find the most difficult to clean: surgical suction tips, the stainless steel, beautiful surgical suction tips, and anything that has a serrated tip, especially bone files, whether they're surgical files or perio files, because the ridges can easily collect bone and blood and tissue, and they're tough to clean. Most practices that use the surgical suction tips have those lovely little brushes and the little snaky devices, for lack of better description, that they put through those suction tips to clean them, which again causes all kinds of risk for spatter or splatter of the contents of those. So again, soaking those suction tips in an enzymatic cleaner, pre-soaking, soaking them in an enzymatic cleaner that is heparinized, that has some heparin added to it, will clean those for you without having to do risky scrubbing. Or the other alternative is suction tips that are disposable. And there are many out on the market that are plastic, disposable, surgical suction tips. And the advantage with those obviously is they're more efficient. You don't have to clean them. They're not horribly expensive. And most of them are made of a plastic that will withstand a sterilization cycle. Now, that doesn't mean that you can reuse them. What it means is you can sterilize them prior to using them because they don't come in a sterile pack. So if you want to have everything sterile to start your procedure, your gauze, any other disposables, including a suction tip, then you can put it through a cycle, but it's a single use, one patient only. And then you don't have to clean the lumens on those. The same thing really applies, the same concept applies for air water syringe tips. The metal reusable air water syringe tips have such a small lumen, it is pretty much impossible to clean them. You would have to take some kind of a very small wire to clean through. And I've seen some research done by the Dental Advisor where our good friend Dr. John Molinari did some research on what was actually collecting inside of those suction tips, and it was pretty frightening. So again, they're not being sterilized if they are not completely clean. So I'm going to make the case there for, again, disposable air water syringe tips. And there are a number out on the market now that are so good. They don't leak. They don't come off in the middle of treatment like some of the early ones did. You know, people all of a sudden during the early days of HIV and AIDS wanted to switch to those, and they did, and then they were messy and leaky and fell off, and so they went back to using the metal tips. But we need to move away from those because they're very, very difficult to clean. So I've talked up to now about using ultrasonic cleaners for cleaning instruments. But there also are instrument washers. Some of you probably use instrument washers in your practice. And there are two basic types of washers. One that simply cleans the instruments and allows them to be dried. And they either come in an under-the-counter model or a tabletop model. And then there are, and an example of that would be Hydrum from Sycan. Thermal disinfectors actually clean, dry, and through a heat process render the instruments or the items put through them much less contaminated or decontaminated because they have been disinfected in that process. So Miele is one of the companies that makes those. It's probably the only one that's available here in the US. But especially with instrument washers, water quality can be an issue. So if you live in an area or you practice in an area where you have a lot of mineral content in your water, it can, in some cases, it can preclude you from using an instrument washer, or you have to treat your water or use filtered water in them. The one thing I want to caution you on, and I've seen a number of these in dental practices, is that dishwashers are not appropriate to be used for instrument cleaning. And there's two reasons. The most important one is that they are not FDA cleared medical devices, like a thermal disinfector, like a Hydrum, instrument washer. So there's some liability that goes along with that. If something went wrong and your instruments weren't cleaned, they weren't sterilized, but the worst case scenario, your patient claims that they got some type of an infection in your practice. And if it's something that could have been transmitted on an instrument, and you have to defend yourself, if you're using any non-FDA cleared devices, if you are not following CDC guidelines, which are the standards for patient care, then you're going to have a very, very difficult time being able to make that kind of a claim or disprove that kind of a claim from a patient. The other problem with using a dishwasher to clean your instruments is that you can only use dishwashing soap or dishwashing detergent in that unit, in that dishwasher. So they all have, most of them have chlorine bleach in them, which is very, very harmful to your instruments over time. In fact, you'll probably get the warranty on your instruments voided if the manufacturer knew that you were cleaning them in a dishwasher with detergent that was meant to clean the dishes. So you can't put enzymatic ultrasonic cleaning solutions in a dishwasher. It just can't happen. So no dishwashers. And I hear from people all the time, well, I really want to buy, or my equipment specialist said to buy this dishwasher that has a sanitizing cycle, and then the instruments will be dry and safe to handle before I put them in the sterilizer. No. That is a big no-no. So be careful about that. Now, instrument washers do have some advantages that certainly they're safer for you to use because you handle your instruments less. Typically, people who use instrument washers use cassettes. And so they stack the cassettes in like the pictures you just saw, like dishes. And you clean them, rinse them, and dry them all in this automated process. However, they are costly. They cost way more than a conventional dishwasher does. There's some space requirements if you are going to have an under-the-counter model, especially, and the cycle time may be longer because of the drying than it would be in your ultrasonic unit to clean them. So larger practices that have a very large volume of instruments, I think, can benefit from instrument washers, and also because they get their return on their investment pretty quickly. But I don't know that it's the right thing for everyone, but the nice thing is we have options. So ultrasonic cleaners are the most common method that I have seen through my entire career in dentistry used for cleaning instruments. People call them the wiggler, the jiggler. I see some that are probably being used way past their useful life. And people will complain, well, my instruments aren't getting clean. And they've either just crammed so many instruments in the unit, or they don't even have the instruments submerged all the way into the solution, which means you're not going to get your instruments cleaned, or they haven't tested their unit for functioning to make sure it's even still working. Just because it's making some noise doesn't mean that cavitation action that's cleaning your instruments is actually happening. So I think there's a kind of an even split in the practices that I have seen between a counter or a tabletop model for an ultrasonic unit and one that's recessed into the counter. It looks much cleaner. It takes up a little bit less space, obviously, up above to have a unit that is recessed into the counter, but it really depends on what kind of space requirements that you have or space available you have in your sterilization area. And if you've looked at ultrasonic cleaning units, you know they come in all kinds of sizes and capacity. So the inclination of many people is to find the least expensive, which typically is the smallest size of a unit, and just make it work. But what you're doing is then hurting your efficiency in your instrument cleaning process. Now, if you have loose instruments, you don't have them in a cassette or a container, then obviously a smaller unit can work. But if you are using cassettes, then you're going to have a larger unit. I worked with an oral surgery practice that was getting ready to equip a brand new sterilization area, and they had picked out cassettes that fit their instruments on their for all of their surgery setups. But what their equipment consultant that they were working with had ordered for them was an ultrasonic unit that was too small. So fortunately, we caught that in time that they could increase the size of the unit. And I just realized I have a typo on this slide, and I apologize. Loose instruments is spelled wrong. So my point in this sentence with the typo is that there is a mesh basket that comes with your ultrasonic unit, and you should always use that. You should never put your hands in the unit to retrieve instruments out. Pull your basket up, let the solution drain, and then remove the basket to remove the instruments. Less risk to you. So again, the size, the configuration of your ultrasonic unit is going to be determined by the types of instruments. How many instruments, what do your setups look like? What do you store them in? What do you transport and clean them in? And make sure that you get enough capacity rather than think you can get by for a time with a smaller unit. And then you realize, well, this really doesn't work. So now what do you do? Especially if you've recessed the unit into the counter, then you've got an opening that you can always make a little bit larger, but who knows if there's room for that. So plan ahead, plan for expansion. Now, I saw somebody asked a question about how can you test if your ultrasonic is functioning properly, and we'll talk about that in just a second. Now, ultrasonic cleaners come with lots of instructions. MFU stands for Manufacturer's Instructions for Use. So the MIFUs, as we call them. Always read instructions for any equipment that you use, that you purchase, that you're going to start using. Make sure you know how many instruments can I put in a load? How many cassettes can I put in a load? If you overpack it with instruments, you're not going to be as successful in cleaning your instruments. Everybody asks me when I'm doing seminars or I'm doing webinars, how long do I need to run the ultrasonic for? And my answer always is, it depends on what the manufacturer recommends. And it's probably a longer time from most manufacturers if your instruments are in some type of a cassette or a container rather than loose instruments. So you need to consult. Now, I do hear from team members occasionally that they don't understand the instructions, or they think the instructions are confusing or ambiguous. In that case, call the manufacturer, ask to speak to somebody in their technical support department, their service department. They can help you. They would love to answer questions for you and teach you or give you pointers on how to correctly use their unit. Now, one of the things that some recent studies have shown is that running your ultrasonic in a heated cycle can make it more effective because it enhances the actions of the enzymes if you're using an enzymatic cleaning solution. And the reason is that when you use an ultrasonic with a heat cycle, it keeps the solution, maintains it at an optimal temperature, which, if I remember right, is around 110 degrees. So it keeps it that way all the time. Now, when you run your unit, you'll notice the solution may get warm, but then it's going to cool back down almost to room temperature. So now you've got to heat it back up again when your unit is run again. So make sure that if you're considering replacing the ultrasonic cleaner that you have, that you give consideration to that, because it is going to make it more successful. You should be testing your ultrasonic for efficacy, I would say maybe monthly, especially if it's an older unit, and you do it with what's called a foil test. I have a picture here that's from a YouTube video. So if you go to YouTube and you just Google testing ultrasonic unit, you'll see a whole number of videos that talk about how to do this process. So essentially what you're doing is testing to make sure that the cavitation action is working. If it is, it will make little dents or actually holes in the aluminum foil that you put in the unit. So I have a protocol that if you email me, I will be happy to send that to you, how to follow the steps. But the YouTube videos are great. They can show you exactly how to do it. Just make sure that you look at one that's designed for healthcare versus an industrial setting, because ultrasonics are not limited just to dentistry. If you ever take your jewelry to a jeweler for cleaning or repair, that's what they're putting your engagement ring in or your wedding ring in, to clean it as an ultrasonic unit. Now, there also are new type of devices. They've been out on the market probably for 3 or 4 years now, maybe a little bit longer, but relatively new to dentistry. And they are cleaning indicators or cleaning monitors. And there's a picture of some on the lower right-hand side. So there are some that are used in instrument washers, some that are used in ultrasonic units. And the little square that you see that's blue is treated with a substance that mimics protein and other types of debris. So if you put this in your ultrasonic and you put it inside of a little container to protect it, when you take it out, that blue area should be completely cleaned off. If not, then you may have some malfunction. Your unit either may need to be replaced, or maybe it's reached its use life. And I know this equipment is expensive, and it's the same thing like sterilizers. Most of the manufacturers of sterilizers will say that their use life is anywhere from 7 to 10 years. But I see practices, and maybe that includes some of you, that have sterilizers that are 30 some years old. Do they still work? Probably. They're passing spore tests, but are they optimal to be used? Maybe not. Maybe they need to be the backup sterilizer, and we have some more current technology for sterilization, but that's a whole other webinar. So ultrasonic solutions are a critical part of how we clean our instruments. And there essentially are technically four varieties available. There's general purpose cleaners. That's what I grew up with. When I was cleaning instruments in a dental office, we didn't even have enzymatic cleaners. So these are detergents. They're designed, again, at the right pH to be compatible with your unit. And then we started to see enzymatics come out when we got more worried about removing blood from instruments, so single or dual enzyme products. And what we're now evolving into, and this is where Brand Max has been sort of a pioneer, if you will, in that they have a triple enzyme formula. So the 3 enzymes that are in that particular product are protease, lipase, and amylase. Each one of those enzymes removes a different type of debris, any of these substances that can come from the patient's tissue. So protease is going to be the most important one, because we certainly want it to remove blood or other protein debris, but we also want to make sure any other debris, whether it's carbohydrate that may come from the polysaccharide biofilm that might be on instruments, or oils or body fat that may be contaminated from the tissue in the patient's oral cavity. So here's a homework assignment. Go and look at your products that you're using. What are you using for an ultrasonic cleaner, and how many enzymes does it have? And If you're not using an enzymatic cleaner, I would certainly move away from using a general purpose cleaner. You're going to have cleaner instruments. In selecting your ultrasonic cleaning product, you also have a choice of what delivery system that it comes in. It may be a liquid concentrate, a tablet that effervesces and dissolves in your unit, or a powder that needs to dissolve. Liquids, I think, are more convenient because you don't have to worry about whether the product gets completely dissolved, but you also have to be careful with any product that you use to follow the manufacturer's instructions for dilution of the product. In addition, some products are multi-purpose solutions. In other words, they can be used also for cleaning your evacuation system in addition to your instruments, but not all of them are formulated that way, so you have to follow the manufacturer's instructions. But the use of an enzymatic evacuation system cleaner is the same principle as cleaning instruments. The enzymes break down the various organic material that accumulates in your suction lines and can cause you to have not as much power, which I think is important right now since so many hygienists are using high volume evacuation in addition to the doctors. We need to keep that suction system as clean as can be so it's operating as efficiently as it can be. Now, in the very beginning, we talked about appropriate personal protective equipment for cleaning instruments. So I didn't show you the whole gamut because I don't see too many people neglecting to wear their safety eyewear, their respiratory protection, or even a lab coat or a gown. But what I do see are many, many people using exam gloves for handling instruments, even if you're using cassettes. There are times when an instrument may be poking out, there may be another instrument. So you need to make sure that you are wearing utility gloves. Now, there are lots of different brands of utility gloves out there, but I'm going to give a plug here for the lilac gloves from Hugh Freedy Group. And the reason is, well, there's several reasons. One is they are sized more for women's hands, which are smaller, so they fit better. Everybody complains about the fit. They also have a liner inside that makes them easier to get on and off. So whether you wear exam gloves underneath the utility gloves or you put your bare hands in the utility gloves is up to you. It may depend on if you share gloves or if you have your own pair, but those are the ones that I would recommend. But they're not the only ones out there. The one thing you have to remember, though, is if you went to Target or Walmart and you just bought a pair of Playtex gloves, they are not puncture resistant. They don't meet the OSHA requirement. So you've got to buy ones that have a rating as puncture resistant heavy duty utility gloves. So when you pre-soak your instruments, you run them through this instrument cleaning cycle, you rinse them, then you need to inspect them and making sure that you check for any remaining debris. If there is some remaining debris on an instrument, you could selectively hand scrub, but you do it with a long-handled brush, not a toothbrush, not a hand scrub brush, because you want it further away from you for reducing spatter. You can run that instrument through another cycle in your ultrasonic. Maybe it was sticking up out of the solution. Maybe we didn't get all the cement or something off of that instrument before it went through. So the next step then is you need to troubleshoot your protocol. So do we all follow the same procedure? Instruments are all immersed. We make sure that we don't let them dry out so the blood doesn't dry on and become more difficult to remove. So you need to have a specific protocol and everybody follows the same steps for cleaning instruments. And then If all else fails, we need to troubleshoot our ultrasonic cleaner or our washer. So I do the foil test. I would look at maintenance records, see how old it is. There's a number of things that you can do. The foil test will probably be the biggest indicator. But a lot of the things that happen in any process, in not just in dentistry, but in any industry or any healthcare setting, really have to do with user errors. So my instruments didn't get cleaned because I didn't have them all immersed in the solution. That's very common. Or I didn't run them for the appropriate cycle time, or I had too many in. But always do that inspection process. I have an oral surgery practice that I work with that does an absolutely amazing job. Every single instrument is individually checked after it's been cleaned. And if they're not really sure, they have a magnifying setup right in the instrument sterilization area where they can put those instruments under the magnifier and they can actually see if there's still debris on those instruments. That's where I want to have my dental care done, where they're really paying attention to those very important details. So we're going to transition over in just a minute to questions and answers. But again, I want to thank BrandMax for their sponsorship this evening. If on your handout, you click on the electronic copy of the handout, if you click on this link, it will take you to their website so you can go look at their products. And it's my understanding that they are going to send you an email that will probably come from Viva Learning. And if you reply back, you can get some samples of the TriClean ultrasonic cleaner, which may be a great way for you to compare what you're using now and see how much better that it can work. So this is my contact information. If you have questions for me after the webinar, please feel free to email me. You can call me, but I'm doing webinars and conference calls all the time. So it's easier to email me with your question. Put Viva Learning January 21, so I know which webinar that you are contacting me about. If there's resources, information I can get for you, I'm happy to do that. But if you have a question about your CE certification, that I cannot answer for you and that I cannot help you with. So contact Viva Learning for questions about your CE certificates. So let's go to our question bank. Thank you all for being very patient in waiting till the end for answers to your questions. The first question I think we answered, is there a brand of puncture resistant gloves? And I think I answered that. I recommend the Hugh Freedy lilac gloves. And I do understand that it's hard to clean burrs and it's hard to package instruments with the thick gloves on, but it really is a matter of getting used to. It used to feel hard to package instruments even with exam gloves or do things with exam gloves on, but we're used to it. But if your gloves fit better, there's actually on the package for the Hugh Freedy gloves, there's a size chart. So you can put your hand on the chart and you know which size will work best for you. Cleaning burrs is tricky, and I do not recommend taking a wire brush and cleaning all the little grooves on the burrs. Soak the burrs. Use a pre-cleaner foam or gel. Soak them. Put them inside of like a tea ball that you would put tea leaves in to suspend them in the ultrasonic unit. But the other thing that you should know is that if the burrs you buy do not come with instructions for reprocessing them, meaning cleaning and sterilizing them, then they are technically disposable, one-time use as classified by the Food and Drug Administration. Some people have just switched to using disposable burrs, and then they always get a nice sharp one for every single patient. But just know that, especially if you're reusing diamonds, then make sure you're soaking them. Use those enzymatic pre-treatment devices. or products, I should say. Okay, next statement. I hear that OSHA forbids to use metal air water because the exact middle of it never gets sterilized and because it gets all the junk from the ultrasonic solution. OSHA has not, to my knowledge, I've not seen anything in any of the standards from OSHA that says you can't use those metal air water syringe tips. However, the CDC discourages it because you can't adequately clean them. And that's why I mentioned that before, that you really ought to be using disposables, but there's not any kind of a rule that says that you can't. I think we answered Veronica's question about making sure your ultrasonic is functioning properly. And one thing I didn't mention, how often do you change the water or the solution? It should be changed at least daily, but sooner if it gets cloudy or if you see lots of debris in it. So most people describe that as the floaties. You get a lot of floaters, a lot of floating debris in there. That's your indicator that you ought to be changing that solution. And if it gets cloudy, can an ultrasonic be used safely with COVID? Absolutely. But you should never run your ultrasonic unit without the lid on, because if the lid is off and it's running, there is potential to aerosolize contaminants in that solution into the air. So always run it with the lid on, but an ultrasonic cleaner is safe to use with COVID. And I'm hoping that's the ultrasonic you were referring to, and not an ultrasonic scaler. Although I think the ultrasonic scaler, which looking at the next question, I think is maybe what you were referring to. If you have the ability to contain the aerosol with HVE, high volume evacuation, if you have an N95 respirator and a face shield, then the CDC has said it is okay to use an ultrasonic scaler. So that we have to clarify that there are two types of ultrasonic technologies that we use in the excuse me, in the dental practice. Someone asked a question about accessing the handout that should be on your toolbar for the webinar. You should be able to access that. And my friend Trung is answering that question for you. Directions how to get it. Do mixing spatulas, like for alginate, are they required to be sterilized? Do you cold sterilize them? Do you wipe them down? Mixing spatulas, depending on the type that you're using, if they have the metal handles on them, you can't heat sterilize them. They will break down very quickly. They shouldn't go into high-level disinfection, cold sterile, because again, the handle, the wood can be porous. So, and I wouldn't wipe them down because you've touched them, of course, with your contaminated hands. Now, they don't get used in the mouth, but I think in erring on the side of caution, I would get plastic mixing spatulas for alginate that can be heat sterilized. Then you don't even have to worry about it. And that's, again, something that I think that you need to make sure that your patients know all the extra things that you do for them, especially if you're in a practice where you're perhaps charging an infection control fee to help cover the extra costs of PPE. Your patients need to know all the little things that you do for them to keep them safe. There's a question about, is there a large price difference between individual packaging and a bottle or the jug? There is a slight difference. I cannot tell you how much. So what you're doing then is trading one thing for another. I'm trading perhaps a more effective solution because it's fresh out of my individual packaging each time versus a bottle that's been open for a while. How do you clean ultrasonic scalers? Now, I believe that this question is ultrasonic inserts, and those if the manufacturer's instructions allow, can be cleaned in an ultrasonic, but the manufacturers, for the most part, say that they should be placed in a cassette, because if they're magnetostrictive inserts, then what you don't want is the stacks to bang into other instruments in the solution. But again, you have to follow the manufacturer's instructions for cleaning them, because you don't want to ruin those nice, expensive ultrasonic tips. You're welcome, Kara. I always acknowledge the typos if I see them. Thank you very much. Usually somebody, and it's typically a hygienist, because we're so detail oriented, that they find those and tell me, do you know that you have one? How do you clean instruments with coronavirus patients? Fabulous, fabulous question. The same way you clean the instruments for every other patient. That's the whole premise of standard precautions. And we've had this discussion over the years. How do you clean the instruments for the patients that have HIV? The same way for the patients that you don't know have HIV. We don't know who all the coronavirus patients are, so we clean all the instruments the same way. Is it required to double wrap cassettes? Yes, it is. So what you have to do is find out, again, read manufacturer's instructions. If the cassette wrap that you use says it's dual ply, it's 2 into 1, then you only have to wrap once. If it's single ply, then you have to wrap it twice. Follow the instructions. How long is best to leave instruments in the ultrasonic? This question goes back to what I mentioned before. Follow the manufacturer's instructions for your particular unit as to how long the cycle is. And again, it may depend on whether your instruments are loose or they're in cassettes. Follow the manufacturer's instructions. Remember, keep the lid closed when you are running it. Can alginate and Invisalign trays be put in the ultrasonic? I don't see any reason why they couldn't go in the ultrasonic, but if they are Invisalign, they can always be cleaned. I'm not sure if you're talking about the Invisalign trays or the aligners. If I have an alginate tray, then I'm going to put it in the ultrasonic and then I'm going to sterilize it. If it's an aligner, I'm not going to sterilize it. So then I need to put it in another container to put down into the ultrasonic unit. Do X-ray RINs need to be sterilized between patients? Yes, they do need to be sterilized in between patients, and they are heat sterilizable. If yours are older ones and they're not, then you need to. Okay, we're kind of getting off topic on the Cavitron, which doesn't really have to do with instrument cleaning. So I'm trying to make sure we get all of the questions answered about instrument cleaning. Okay. Can dry shield autoclavable mouthpiece be cleaned in the ultrasonic? Again, go back to the manufacturer's instructions. Always go back to the manufacturer's instructions to know what to do. Now, some of you asked questions that were related to other topics. And what I would ask, because we are now at our time to end the webinar, what I would ask that you do is send me that question via email. And again, put Viva Learning January 21st and ask me your question. I'm happy to address that question for you as best I can. So thank you all for your participation, and make sure those instruments are nice and clean before you put them in the sterilizer. Have a good day.